My name is Gopal Menon. I'm a surgical oncologist and I work at the Goshen Center for Cancer Care. So I think the great thing about our cancer center is that we're providing tertiary or even quaternary level care, really. The same kind of care that you would expect at a big university hospital, in a relatively small town and in a relatively small hospital. But the thing that really struck me when I first interviewed at Goshen was the caliber of essentially every single medical professional, be it radiation oncology, medical oncology, the surgical team, the team of people that's incredibly well trained and incredibly collegial. And I think that it's very, very unique to have this level of care, especially coordinated multidisciplinary kind of care in a small town like this. I don't think that many of these kind of centers exist. I enjoy spending time with patients and getting to know them. I think that's one of the benefits of doing exclusively cancer is that I find that in my practice I'm not really rushed and I have the opportunity to sit down and really talk to patients and get to know them and their families. And I found that being able to explain exactly what's going on, starting from the origin of their cancer to how it progresses and talking about the anatomy and their physiology and trying to break that down into little bite-sized portions that anybody can understand, especially when they're faced with the new reality of being a cancer patient. I have found that rewarding. We are happy to furnish patients with second opinions and that they continue to have treatment closer to their home or with another physician. That's absolutely fine, and that's the patient's decision. We are more than happy to do that. Our surgical oncology team here at Goshen Center for Cancer Care, we treat disorders of the entire GI tract. So by that I mean the esophagus, the stomach, small and large intestine, as well as diseases of the liver, the pancreas, and essentially anything else in the abdomen. In addition to that, we also do a lot of head and neck cancers. So for example, disorders of your thyroid or parathyroid gland, disorders potentially of any of the salivary glands, and also disorders of the skin. I think communication with referring providers is really, really important. I know that referring providers have a wide variety of choices and that they want the best care for their patient, because a happy patient, or you're referring to somebody that makes the patient happy, also reflects well on the referring provider. So I take that very, very seriously. Providers that refer to me, I will typically reach out to them by email and have a copy of my notes sent. Most times I'm able to get the provider's cell phone number, and if they're okay with that and if their office is okay with giving it to me, I almost always send a text and try and set up a time to talk to them about their patient and let them know my thoughts so that we could make a joint decision. So I think anybody who is referring to me can expect to be in touch with me essentially at their convenience.